Hello everybody. Today we are going to talk about wounds and ulcers and cuts and bruises and how to treat them homeopathically. I'm hoping I left it on for a little bit, hoping for a few people who might join in, but I'm really going to talk about how to work with, your child has wounds and we're too used to taking Bactrim or iodine or other solutions that are very toxic to the epithelium, that destroy the cells of the epithelium and keep them from actually healing the wound. So if your child falls down, scrapes his knee, if you have if you fall down and hurt your knee or scrape your knee, if you're bruised, if you have deep bruises, there's nothing more wonderful than homeopathic remedies to cure without leaving any lasting after effects, without leaving any septic conditions, and really having a curative effect on that wound. So we're going to talk about two things. One is hypericum, and you can buy this at the Rainbow Groceries. I'm bringing this in for a couple of friends of mine. And the second is calendula. And what I'm going to do is I'm going to read from the book of a great doctor who lived about 68 years ago by the name of Dorothy Shepherd, who wrote about this. She was an MD and she went over to homeopathy. She saw the light, she went over to homeopathy and never looked back in treating her patients with all sorts of homeopathic remedies, and had very good success in the First and Second World War with wounds and the dressing of wounds and the cure of terrible, terrible war wounds. And so I think it's a good idea for me to actually read from her book so that you understand some of the logic behind applying calendula and hypericum to wounds. So what she says is this. When the tissues surrounding the wound of your child, etc., are reasonably clean, apply calendula dressing as a calendula lotion as a dressing, either in the form of a diluted tincture of the succus calendulus, which is basically calendula juice, juiced in with and preserved with alcohol in a ratio of like 1 to 5 or 1 to 10, and that is a diluted calendula succus. Okay, diluted tincture of the succus calendulae, the fresh plant juice. The disadvantage of the latter is that the fresh plant juice is it does not keep very long once you open the bottle. So if you use fresh juice, you could juice your fresh calendula flowers. But both of these can be obtained from any good homeopathic chemist. Calendula is the most satisfactory wound dressing I have come across, and I have tried a good many. And folks, this person has experience because she worked in wards in the First World War, Second World War, when London was being bombed out of existence and the wounds were terrible. Shrapnel, glass, this and that. Scientific medicine bases its theories and treatments on mass control observations and statistics based on them. For 15 years as a medical officer at a surgical outpatient center, I have seen and watched the efforts of various antiseptic dressings on many varieties of wounds, ulcers, sores, etc., seeing on an average more than 80 cases per week. I have not seen 80 cases in my lifetime. This woman, who used to be an MD, has seen 2,000 cases a year. On these figures, I consider I'm entitled to base my conclusions that the methods I now employ are superior to the older and more generally accepted methods of iodine, acids, Lysol, penicillin, sulfa drugs, Bactrim, and all sorts of other antibiotics. The methods I employ, she's saying, are superior to the older and more generally accepted ones. For these cases, I've yielded much better results, 95% results. Of them, 95% of them are cured and fit for discharge under a fortnight. These are very, very serious wounds and injuries. Well, in the olden days, it was exception to discharge any case within the specified 2 weeks. I mentioned this period because after that, the patients were asked to pay an extra fee to stay in hospital. Back in the day when you kept people in hospitals for 2 weeks. Calendula officinalis, this wonderful thing, which you can find at your local health food store, a local grocery store, possibly, is not an antiseptic in the true sense of the meaning of the word, but germs do not thrive in its presence. It inhibits their growth, I find, and even when wounds are already badly infected. I have seen offensive, purulent discharges become clean and sweet smelling in a day or two. So you might ask, if something is not an antibiotic, how does it have an effect? And it's the same effect that the Banerjees, doing the Banerjee protocol for brain cancer, found with Rutagrav. Rutagrav, graveolens, in very ultra-dilute doses given to patients with brain cancers, glioblastomas, which are rarely curable by any other modern allopathic means, responded to Ruta by killing off the cancer cells and actively stimulating the telomeres in the healthy cells. Which other medicine can boast these kinds of properties? Today we have immunotherapy where you have one molecule that can do this sort of thing, but in homeopathy, 300 years ago now, Hahnemann discovered that you can actually use ultra-diluted doses of substances that do not even contain molecules of those substances. Sounds hokey, but they contain nanoparticles, we've now discovered, can actually have a very curative effect on your immune system, sort of like vaccines without the side effects of vaccines. Okay, so back to Calendula officinalis. It's not an antiseptic in the true sense of the meaning. So, but germs do not thrive in its presence. It inhibits their growth, I find, finds Dorothy Shepard. Everyone should have this book. And even when wounds are already badly infected, I have seen these purulent discharges become clean and sweet smelling in a day or two. And in the rare cases where it does not answer so quickly, there are other plant tinctures which you can use, and one of them is hypericum, and we'll talk about hypericum. Here is hypericum, and what you do is you take literally a drop of this and take it in a half cup to a cup of boiled and cooled water. You don't even have to use boiled water. You can put a drop in this and dress your wounds with these and leave it open. If it's a deep wound, cover it with gauze and wet it with the calendula tincture, and you'll find that it encourages the growth of fresh cells while shutting down septic conditions, while shutting down secondary infections. And that's the property of calendula. Calendula is also wonderfully soothing as an external application. It neither destroys nor irritates any new epithelial cells which are growing. On the contrary, it stimulates their growth. How does it do that? I don't know. It's mysterious, but it does. The calendula tincture is diluted for use by adding 1 teaspoonful to a pint of boiled water, but lately I've found that ordinary unboiled water will do just as well. So it inhibits the growth of microorganisms, and in doing so, pus will never make its appearance in a clean wound and will disappear rapidly in an infected wound if calendula is used as a dressing. If the wound is, and this is especially true for the folks in the Health and Nutrition Club, if you fall down, hurt yourself badly, if you have diabetes, if you have gangrene from diabetes, it's important to remember to use non-toxic therapies to heal, because they will heal much more healthfully and help you in clearing the wound much faster. If the wound is deep, one can syringe with calendula and pack it lightly with gauze soaked in calendula, covering the wound with a dry gauze. Cotton wool, and bandage. The wounds in the majority of the cases need only be dressed once a day. You don't have to do it more than once a day, or twice a day, or 4 times a day. You can do it only once a day, unless they're very acute and there's much inflammation present. Okay. In some cases, in order to prevent the gauze sticking to ulcers in raw areas, it is left on and moistened with the lotion whenever it becomes dry. So you can apply lotion. This here is tincture in alcohol. A lotion is calendula in a fat of some sort, whether it's lanolin or beef fat or olive oil or whatever, or fresh juice of calendula just stirred into oil. That's a lotion, something that's anointed on. Okay, so by this method, the wounds and ulcers heal more rapidly than with any other antiseptics I have tried. Okay. This really applies for dressings of war wounds, which are very, very serious. Ulcers, septic fingers, diabetic fingers, and not merely to first aid dressings. Okay. Calendula dressing, a little bit of history on calendula. They were used in the American Civil War by a number of surgeons who recommended their use. There was the surgeon during the American Civil War, Mr. Carleton, a surgeon of one of the large hospitals in the United States. He used calendula for all his operation cases, both abdominal as well as bone surgery, with very, very good effects. He actually published his results on the efficacy of calendula in surgery. Yet another American doctor, 1914 to 1918, the First World War, worked as head surgeon in one of the field hospitals. And why am I giving you this historical perspective? We have forgotten that mankind has treated wounds through all of history. Mankind figured out ways to heal wounds in a very efficacious way without using synthetic and petrochemical-based products, which is what we're using these days. And antibacterials and very toxic and corrosive chemicals that prevent new tissue from healing over on your wound. Okay. There's another surgeon by the name of Dr. Petrie Hoyle. He received very high praise from a visiting staff officer for the clean state of the patient's wounds, the absence of smells in the wards, and was congratulated on the rapid evacuation of cured cases from the hospital, as well as the low mortality rate. So these were very serious wounds. No smell, meaning no gangrene. It did not suppurate. It did not get into the body. And in fact, the organs, the limbs did not have to be amputated, or the organs. And they were evacuated rapidly and fully healed from their army hospital camps, and therefore not unique in my appreciation of calendula, says Dorothy Shepard, a first-class homeopath, as a first-class dressing for wounds. My only regret is that it is not better known and more widely used. And I'm hoping that by making this video, we can pay homage to this amazing doctor who was able to do a lot for patients with all of these cures. So everybody should grow calendula, or the common marigold, on any spare patch of garden they have. Grows very easily. How do you use it? The half-open buds or newly opened flowers with the gummy end shoots are parts used for the tincture of the succuss. Buds and flowers should be pounded and macerated in a 50% alcohol solution. If you use stronger alcohol, the valuable balsam, the aromatic compounds in the plant, the balsams will coagulate. And placed in corked bottles, should be shaken frequently, several times a day for 3 weeks, to extract all the ingredients and remove the clear fluid by filtration, and keep this tincture as stock. The fresh plant juice or succuss is made by pulping the buds and flowers and soaking them in warm but not hot water for about 12 hours, and then the lotion is ready for use. Add a small quantity of alcohol if you want to preserve the liquid for a short period of time. Okay, so you can apply the fresh yellow florets of the flower directly to a wound as well and cover it with a bandage, or you can pulp them. Fresh blooms can be applied and bound over the wound. This method answers particularly well in all kinds of insect stings, bees, wasps, etc. So moms with children who get bitten, keep that in mind. This is a wonderful natural therapy that heals your skin much, much faster. You can also use calendula ointment. It's extremely, extremely soothing. and heals rapidly when applied to all kinds of cuts, cracks, chapped hands and legs, and small septic spots. It is much greater value than the ubiquitous boracic, zinc, or calamine ointment, because those are essentially antibiotic. They're poisonous. What is poisonous, folks, to the bacteria on your skin, the fungi on your skin, the protozoans on your skin, is also toxic to your skin, which is made of the same substance, right? And so you can make this calendula at home by melting fats such as spermaceti, if obtainable, or even lanolin or mutton fat mixed with a little bit of olive oil to make it liquid. Otherwise, it's too hard. Add a tiny amount of calendula tincture to half a pound of the melted fat, stirring it with a spatula. And a lot of these arts are now lost, and it's a good idea to gain them back so you don't have to rush to emergency every time. You don't have to rush to hospitals every time your child gets knocked on the head, has a bruise here, has a bruise on their elbow, and they're very, very healing. Okay, so you've added the drachma of calendula tincture to the half pound of melted fat. You stir it. You can also use one of those blenders, an immersion blender, or the cake mixing blender, and make your lanolin solution or your fatty ointment thusly. A case that came to my notice recently which showed the healing property of calendula was that of a woman with a splinter broken off and left under the nail for 12 hours. This was removed. It was so bad they had to cut back her nail with a sharp scalpel under cocaine. They didn't have anesthesia locally. They used cocaine. The calendula ointment was applied and 1 dose of ledum given. The pain disappeared at once and the finger healed without any further trouble in 12 hours. The remark that the patient made was that she had many splinters removed at various times. This brings to point the important fact that once you hit it once, you keep doing it for some reason. I stubbed my toe once, I stubbed it 4 times after that. You stub your fingers, you keep hitting it on something. And when that happens, you need a natural solution to your problems. The remark the patient made was that she had many such splinters removed at various times, but never as little pain as during the removal or afterwards, and this speaks for itself. She also talks about hypericum, and so what is hypericum? It's actually St. John's wort, and it is used for nerve pain. This is the solution of hypericum in alcohol. You do the same thing you do with hypericum that you do with calendula. Calendula you're applying on broken wounds. So you take literally a drop of this, put it in a half cup to a cup of water, you take that water, you stir it, and you apply it on the wound, and it will heal very rapidly without sepsis. However, if there's shooting pains, if you see around the wound, there's a red, black, and blue area, and if pain is shooting upwards and radiating outwards, that means your greater part of the surrounding tissue is infected and there's nerve pain. In that case, you take this hypericum tincture, same thing, 1 drop, literally 1 drop. So this tincture, folks, mums and grandmoms and aunts and uncles, will last you a lifetime. You literally take 1 drop of this in a half cup of water and you paint it around the edges of the wound, and the infection will heal, the nerve damage and the nerve pain will heal rapidly. So you need to have these 2 on hand at all times for any cases of accidents, injuries, severe wounds. People who are diabetic and go into the hospitals for addressing their wounds can look no further than this, because this is mysterious and wonderful in that it prevents sepsis without being an antiseptic. That is calendula. And so what she says is, now we're going to talk about hypericum. The hypericum tincture is, and the reason I'm reading this is it's written better here than anywhere else. And why not follow the counsel of a person who treated 2,000 cases per year during war years when people had horrible, terrible war wounds that were cured with these wonderful, wonderful plant tinctures. Hypericum tincture is made in a similar manner as a calendula tincture. There's, however, an alternative method of preparing, and that's by taking a large handful of the hypericum flowers and placing them in olive oil and stirring them over gentle heat, very gentle heat, for half an hour while all the goodness is extracted. The flowers are then removed, the oil is allowed to cool. This hypericum oil is wonderfully soothing and healing for all kinds of sores, especially nerve pain, any kind of nerve pain, fibromyalgia, folks with fibromyalgia, folks with wounds that have a lot of radiating pains around them. On the whole, I prefer hypericum for highly septic wounds. If they're very septic, whitlows, that's, things around your nails that get infected. Septic nails, cellulitis, if you have gangrenous toes, ulcers, people with diabetes, hypericum is ideal. You take hypericum internally, you apply hypericum externally with very, very good results. This is the most useful in those painful conditions or herpetic pains extend from the seat of the injury. A headmaster came for treatment for a septic finger. So she cites an example which he had tried to cure for a fortnight with boracic acid fomentations and later magnesium sulfate and all kinds of things without any effect whatsoever. The pain and the sepsis increasing in severity rather than decreasing. When I saw the whitlow, I was afraid his finger would need to be amputated and would destroy the tendons. Hypericum dressings were applied twice daily, and he was given silica internally 3 times. So what does silica do? If you have a suppurating wound, if you have something that's got pus in it, it'll help to push it out of your body. It'll help to suppurate it out of your body safely and healthfully. So he was given hypericum dressing, silica internally 3 times a day. Silica because of the history of long sepsis without any crushing or laceration of parts. You do not want to use silica when your finger is crushed. Like when my finger was crushed in a door, I used hypericum. I did not use calendula because I did not have an open wound, but I had pain like the bejesus. Pain when your fingers are smashed in a door is horrific. And so start with arnica. It was black and blue, no more black and blue. Afterwards, I had numbness and tingling and Raynaud's-like symptoms. None of that anymore. It healed beautifully. And so that's what you can use hypericum for. You use silicia only if it's in suppuration. Low doses of silicia. For external applications to boils and carbuncles, I prefer hypericum to calendula, and wherever there's extensive laceration of the tissues. There was a young lad who had cut his skin against some paving stones. The wound was gaping and he complained of great pain. It was cleared up in 1 in 25 hypericum. So remember, you are not using dropperfuls of this, guys. You're using 1 drop in 25 to 50 to 100 drops. So you're diluting it greatly and using it to clean. It was used to clean the gaping wound. Hypericum, 1 in 25, and a hypericum dressing, that is with ointment, were applied, firmly strapped across. It was healed in 2 days, record time. What do these things do? They don't just prevent sepsis, they actually promote healing. You cannot say that about antibiotics. I remember the case of a man in hospital who had an accident to his leg, which had torn the attachments of the muscles from the tibia. So when you have muscles and tendons and connective tissue destroyed, the wound was cleaned with hypericum while the man was under anesthetic, and after the tissues were replaced, a hypericum dressing was applied and strapped firmly across in position. This was not removed, but hypericum lotion was applied between the strappings. All they did was applied lotion on top of the bandage. The wound was healed and the man discharged from hospital in 1 week with only a slight limp, which disappeared in due course. Dorothy Shepard says that she has used hypericum in so many cases that it would be just a repetition of what she has said already. And now a practical hint from Dr. Shepard. These plant tinctures are expensive to buy in the first instance due to the high cost of the alcohol. Back in the war, nothing was available, so even alcohol was barely available. They're, however, extremely economical in use as only a few drops are required, the same with ointments. A teaspoon of tincture will medicate half a pound, of ointment base. And you apply the ointment with care and moderation. So this is how you work with open, lacerated wounds that are bad when you don't want to apply antibiotics, when you don't want to apply all sorts of allopathic painkillers, when you don't want it to get infected, when you don't want it to have sepsis, if you're diabetic, if it looks kind of black and blue and gangrenous. And I hope it helps. If you have any other suggestions and comments for addressing wounds and mashed fingers and lacerated injuries, please feel free to put them down below. And I hope you have a healthful day today. Thank you very much.